Mr. Chair. And thank you to all of our witnesses for offering your testimony here today. I'd love to spend some of this time honing in on the issue of drug shortages. Drug shortages, of course, are more than just an inconvenience for a lot of people, but they can have deadly consequences for people in urgent medical situations. And one of the most common drugs in the United States right now facing a shortage is the liquid form of albuterol, which is used by hospitals to treat asthma.
Hey everyone, welcome back to True Voice. I'm Andrew, and if you believe in truth, justice, and rebuilding this country from the ground up, make sure to hit that subscribe button and turn on notifications so you don't miss a beat. This video is a must-watch. We're reacting to a congressional hearing where Representative Alexandria Ocasio-Cortez called out something most politicians ignore: the dangerous failure of our healthcare system to deliver basic medications like albuterol for asthma to people who desperately need them. Let's watch.
Albuterol has been in short supply since 2022, and this is an issue that hits particularly close to home in my community. In the South Bronx, in particular, we face one of the highest childhood asthma rates in the United States. And when these kids and their parents show up at a hospital and they're unable to breathe, they may not be able to access the medicine that they need if there is a shortage. Ms. O'Connell, can you help the general public understand why is it that in such a common condition such as asthma and with such a broadly available drug like albuterol, how can we get to a place and how do we get to a place where there's a shortage of it in the United States?
Thank you so much, Congresswoman. Albuterol wasn't one of the issues that we dealt with directly in ASPR, but observationally, I think it's a perfect example, as you've laid out, of the fragility of the generics market. Albuterol is a generic drug. There had two manufacturers in the United States. One of them declared bankruptcy and left the market. That left a shortage, and there have been very few incentives, as have been discussed already at the table, to encourage generic manufacturing of albuterol in the country.
Thank you. And I think to kind of disentangle this a little bit more, there's a lot of talk about incentives, but at the end of the day, the United States healthcare system is a for-profit system. And largely, an incentive is about if making it is profitable. And in a for-profit system, manufacturers need to know that their drugs will be profitable. If it's not profitable, the incentive doesn't exist, it becomes difficult to manufacture. But if manufacturers can't afford to operate, they will leave the market altogether, as you noted, or move their operations abroad. Meanwhile, drug shortages are costing hospitals at least $360 million annually in labor costs alone for making up for some of these shortages. And so what all of these pieces put together are pointing to is a market failure. And ironically, this market failure is emerging because the drug is affordable, is because the price is very low. My understanding is that the federal government has effectively acted in the past to address drug shortages. And in particular, both Republican and Democratic administrations have used the Defense Production Act to address past drug shortages. There's been some discussion today about almost like a strategic reserve of sorts, but for medicine. Ms. O'Connell, what is the Defense Production Act, and has the federal government used it in the past? How has the federal government used it in the past to address drug shortages?
Absolutely. Thank you so much for the question. So the Defense Production Act is an authority that allows the government in times to secure the defense of the nation or in times of emergency to priority rate contracts to ensure that the supplies that are in the supply chain go to whatever is needed to secure the country. So in a case of shortages, it would go to the manufacturing of the particular item that's in shortage to be able to provide that item to the American people. We used it multiple times, dozens of times throughout the COVID response, both the Trump and Biden administrations. And then outside of the COVID response, we also used it for the infant formula shortage, and we used it most recently for the Baxter IV shortage.
Thank you. Yes, those are all excellent points, because we are hearing talk today of moving manufacturing to the United States, and it's not to give short shrift to that point, but some of those examples that you named, albuterol is manufactured in the United States, IV fluid manufactured in the United States. Even a couple of years ago, baby formula, also produced in the United States. All three of those things are produced in the United States. All three have had chronic shortages. Ms. O'Connell, could the federal government play a role in manufacturing some of these drugs where we are seeing persistent market failures? And I'm interested in some of your thoughts to that point.
Well, this is a question that we always come back to. Should the government be responsible for the manufacture of, say, vaccines? That was a question we asked ourselves during COVID. And what it comes down to is a commitment from the government to fund both the capacity for the government to do the manufacturing as well as the capability for the government to do that manufacturing. And over the course of our analysis and looking into this, and over many generations of others in similar situations needing to answer that question, what's needed most is a sustained commitment in funding. And that has not been something that's been demonstrated from previous Congresses. And so we always went to the public-private partnership, which is a perfect thing that BARDA does, which is invest in the capacity that the private companies have, reserve that capacity for the United States. But the United States doesn't own the actual physical structure and do the manufacturing itself.
Thank you.
Here's the deal. AOC shines a light on a national disgrace. We have a shortage of albuterol. That's the stuff kids use in inhalers when they literally can't breathe. We're not talking about some rare medication from halfway around the world. We're talking about a basic, life-saving drug, and we can't keep it on shelves in American hospitals. Look, I don't care if you're from the Bronx, Boise, or Baton Rouge. If a kid shows up at the ER gasping for air and the hospital doesn't have what they need because some company went bankrupt, that's a failure of our system. Period. And what's even more outrageous, this is happening because the drug is too affordable. Yeah, let that sink in. The drug is so cheap that it's not profitable for manufacturers, so they stop making it. That's not capitalism working. That's capitalism failing Americans. And while kids can't get medicine, hospitals are bleeding out $360 million a year just trying to deal with these shortages. Who pays for that? We do, through higher insurance premiums, medical bills, and, most of all, through lost lives and trust. As a proud Democrat and patriot, I'm going to say what some folks are afraid to say. It's time for the government to step up. We've used the Defense Production Act before, during COVID, during the baby formula crisis, and even for 4 fluids. Both Trump and Biden used it. This isn't about party. It's about protecting Americans. So why aren't we using it more now? We should absolutely be talking about federal manufacturing of essential drugs. If the market can't provide, then the government should. This isn't radical. It's responsible. AOC nailed it when she said, this is a market failure. And I respect her for pointing out the hypocrisy. We say we want to bring manufacturing back to the U.S., but even when we do, we still can't keep critical supplies flowing without public investment and oversight. You want to talk about patriotism? Real patriotism is making sure every American child can breathe. Real patriotism is building a country where your access to medicine doesn't depend on Wall Street's profit margin. So I stand with AOC, and I stand with any leader, left or right, willing to fix this broken system. Because we don't need more excuses. We need action. If you agree that healthcare should put people over profit, hit that subscribe button, share this video, and drop a comment with your thoughts. Should the government start manufacturing essential drugs? Should we be using the Defense Production Act more? This is True Voice, and I'm Andrew. Stay loud, stay proud, and stay in the fight.